On behalf of Department of Community Medicine, I welcome you all. Our department is situated in the block 1, that is administrative office, principal's office. In the whole first floor is the community medicine department. It is a large department. Number of faculties are also more. There are museum, there are lab. If you can go, all these are open if you are interested. Now, one thing is there, not for my class or our class or any department class, I always used to say, please, number one, keep your mobiles either shut or in the, minimum, because it causes tremendous problem to the, not only to the teachers or faculty or to your fellow members. Second thing, if anybody wants to learn or anybody wants to attend the class, please attend. But who don't want to listen, please don't come to the class. You will get the percentage. All you know, biometric attendance, all these things, nobody will punish you. Because I always used to say this is a democratic country. Now it is democratic. I will not attend class. I will know all these things. So it is up to you whether you want to learn. But who wants to learn, please, the others are coming or whispering or don't cause disturbance. It is not for our class, our department, our subject, for all departments. Another thing I used to say, all science is developing very fast. So everything, even when you go to the grave, most of you are Bengalis, I think. How many non-Bengalis are there? Now, regarding non-Bengalis, we sometimes use the Bengali pronunciation. But for non-Bengalis, I used to say, please learn Bengali because you are in the medical science. So you will deal with the patients. You will ask the patients, আপনার নাম কি, আপনি কি কাজ করেন, আপনার মাইনে কত, আপনার education level কত. So if you want to communicate with them, you have to learn Bengali. Bengali is not very difficult language. It is very sweet and it is easy language. And you will be in this course and in postgraduate course for so many years, 5 years, then again 2 or 3 years. So even 7 and 8 years. So you learn Bengali, those. And if you don't understand any faculty using the Bengali words, please, sir, repeat again, madam, repeat again. Always ask questions. Always remember that even at this my age also, I finished 2 newspapers, one Bengali, one English. And if I cannot finish the 2 newspapers before going to the bed, so I am not happy or like that. So learning is throughout the process. Don't think that the sir knows everything, because the idea of or the teaching and training methods have changed throughout the world. Previously, when we were students or our fathers or mothers or parents were students, there is a one-way communication. Our teacher used to say. Now it is coming to the interactive sessions. You ask questions. Sometimes you don't think that I know everything. Everybody have to learn. So don't think that if I ask questions, my fellow friends may think otherwise. If he thinks otherwise, it is his or her fault. So if you don't understand, or after the class, or anybody during free time, go to the department, for any department I am talking about. So ask questions, sir, please repeat again, or sir, I could not understand, and all those things. Okay. So this is the primary things. Now, community medicine actually, when we were students, community medicine at that time used to call preventive and social medicine. Before that, when our teachers were there, at that time it is used to call preventive medicine and hygiene. Now it is called community medicine. And when this nomenclature adopted community medicine is probably, I cannot remember, probably in the later part of 90s. So then usually during our time, community medicine or preventive or social medicine or public health, you can say, that is used to be taught or discussed at the 3rd year only. Okay. And at the end of 3rd year, exams were there. When the name community medicine was done and the department names also changed and all those things, then community medicine used to start from the 1st year of the class. 1st year, very 1st year. And it will, your exam will be held at the end of third year. Now you can understand what the importance of community medicine. You may not like community medicine, I am telling you. So most of them like, but for your exam point of view, for knowledge point of view, for your postgraduate course also, community medicine is a very, very important subject, because suppose I am giving you examples. After MBBS course, most of you sit for the postgraduate course, and nowadays probably all of you know, during our time, postgraduate teaching, admission to the postgraduate course to the particular subject, the admission test used to be held on that particular subjects. Suppose you want to become the obstetrician gynecologist, so you will give admission test on obstetrics gynecology. You want to be the postgraduate course in anatomy, so subjects of anatomy questions are there. That may be MCQ or like that. MCQ, you understand? Multiple choice questions. Now for the last 20 or 25 years, it has been done that there is only one examinations which the exam paper or MCQs will consist of all subjects, and subjects of medical science have been increased a lot, all subjects. Out of those all subjects, that is in postgraduate admission test, you will get questions on anatomy, physiology, biochemistry, pathology, microbiology, medicine, surgery, gynae, ENT, eye, what not, and community medicine. And out of all subjects, questions of the community medicine is much, much more. That we will understand why, because we want to understand community. Okay. So, whether the subject you like or not, because it is a human nature of us. When we enter the medical science, we always used to treat the patients. How to treat the patients? How to treat the patients? What is his signs and symptoms? So, our interest on this, what is your sufferings? What are your signs and symptoms? So, interest is still on those days. But community medicine, not only for exam point of view. Second point, community medicine, as I belong to community medicine, for this I am telling no, not like that. So, second point is, if anybody wants to be in service, mainly community medicine scope, most of the, you see, suppose West Bengal, the top of the positions, suppose in district it is called CMOH, Chief Medical Officer, they are community medicine experts. Then after them, some it is called deputies are there, and these are community medicine experts. Nowadays, probably you see in the newspapers, in Arjikar case, Dr. Subarna Goswami, probably you have seen most of you in the Subarna Goswami. He was my student. He is from the Department of Community Medicine. He has done Master of Public Health. And another scope is there, if you want to join in international service, like WHO. What is WHO? Very good. And don't say who, because WHO, don't say who. Examiner may give you 0. WHO, always say WHO, don't say who in the exams. So WHO, that is World Health Organizations. And World Health Organizations job, very much lucrative, very much you have to go, your post may be in Geneva, you may go to America, England, all those things. Then from community medicine. If you want to join in UNICEF or like that, different international organizations, all these things you will learn, that is your subject also there. UNICEF, United Nations, even some of the medical posts in World Bank also, these are from the community medicines. Okay, but that is up to you, all these things. So this is in general, all of you will understand slowly and slowly. Today I will discuss in the first class the simple what is community medicine, its basic concepts are like that. The subject has increased a lot. So you will get nowadays, you know it very well, most of the books you will available in the library or like that, but very common book till nowadays we also follow, so many books are there. Park's textbook of preventive and social medicine, Park, P-A-R-K. So if you want to, if you read it properly, that is enough. Park's textbook of preventive and social medicine. So the name still it is preventive and social medicine. So if you want to buy a book, so many books are there. So even one is enough. And other books you will get in the library and all those things. Nowadays plenty of them, you will go to the Google and other things, but I always used to say there is no match for textbook. Don't think that always Google, Wikipedia, these are very much knowledge and all those things. Sometimes not. But if you want to, surf internet, some of the community medicine or other experts in WHO website. WHO website is very good. UNICEF website, WHO, World Health Organization. But to get for your knowledge, I will say, yes, go to Google Baba and all those things, but go to textbooks. Always, it is much more for your exam purpose and all those things. So for this, it is community medicine. So what do you mean by now community medicine? Usually, another thing is there, as I have already told you, it has increased a lot. In exam, after the end of third year, community medicine has 2 theory papers. There is 200 marks. First paper, second paper, 100, 200 marks. And another 100 is for practical and oral and viva person. So much of importance given in community medicine. I don't know how much anatomy is there and all those things. It is how much subjects, all those, these are changing. But in till date, in community medicine, 300 marks exams. Our, when this college established, Santiniketan Medical College, the first year batch is 21-22. This first year batch will appear for university examination this January, at the end of this January, first batch. So you understand, so now you are the 4th batch. So this first batch will appear for the. So from the first year, we are teaching and training community medicine. Understand? So how much importance. As we have to deal, suppose anatomy, physiology, biochemistry, they are dealing only you, because after the end of first year, you will appear for anatomy, physiology, biochemistry. So they don't have second year. But as we have to deal with, including your batch, we are dealing with 4 batches. It is not. So our faculty numbers also more. Okay. So sometimes I will go class and other will come to the class. Even today also second year classes there, not only, and then practical classes, there are so many classes are there and all these things are going on. Now coming to the community medicine, you know the clinicians, clinical medicine and all those things. There is a patient comes to you, I will ask and that is called clinical medicine like this. But community medicine, you are treat the community. Suppose this 24-25 batch of these students, you can call it a community. You can call the this name of this Govindapur, na? Govindapur Muluk. So Muluk may be a community. The Bolpur subdivision may be a community. The Birbhum district may be a community. Okay. Or the whole West Bengal may be a community, or like that. Or there are communities, other things. If you religion wise, there may be Hindu community, there may be Muslim community, there may be Christian community, or like that. There may be in a school, that may be a community. So community medicines, their patients are the community. The community medicines apply principles or manage the whole community. You will understand all these things. You will understand. Suppose you have seen the immunization. Most of you have taken so many immunizations since your childhood. We have not taken that much because during our time probably we have taken only smallpox, or they were not that. So now you are taking not only BCG, polio, DPT, pentavalent, plenty, measles, all these things, so many. And this is the principles of because by giving immunization or vaccine, you are treating the whole community. When I was students, we used to call, examiner asked to me, what is the infant mortality rate? Do you know what is infant? Who are infants? Everybody is child. Will understand. Infant means who are up to 1 year of age. Infants. So this infant mortality rate usually 150 out of 100 live births at that time. Now, after the introduction of these vaccinations or immunizations or other nutritive interventions, nutrition and all those things, good food, breastfeeding, so much of breastfeeding encouragement, we call it nowadays exclusive breastfeeding. Exclusive breastfeeding means up to 6 months of life, the baby will get only breastfeeding, not even a drop of water, only breastfeeding. It is so much importance. This science develops, so they will not suffer from different diseases. And after that also breastfeeding will be continued as long as it is available, up to 2 years or 3 years if it is available. But after 6 months of age, when the baby is growing, the demand becomes more, the secretion of breast milk becomes less. So we have to add other food. বাংলাতে যেমন মুখে ভাত চোখে ভাত হয়, মুখে ভাত মানে কি introduction of other semi solids and other foods. Okay, that may be plus minus 6 months. Okay, so now infant mortality throughout the India becomes less than 30, 25 or like that. So much of improvement, and these are the principles of community medicines. So community medicine treats the whole community. So by providing government actions, all those things. And community medicine application is mainly in the government sector. Private and all those things, private hospitals or private hospitals, yes, private hospitals, they don't give that much of programs on community medicine related or public related program. They are mainly doing curative medicine. But government medical colleges or government healthcare delivery systems who will discuss and all those things, probably you have heard primary health center, all those things, they are mainly, most of you will enter in the government health service. Most of the teachers were in government health service. So after it, I was in central government, and after retirement from central government, after 65 years we entered, it is for all the things, retirement. Most of you, because who are old, they are mostly from government health service. So many of you will enter the government service. When you enter the government service and will be posted in rural areas, in blocks or in districts, you will provide mainly community medicines, applications of community medicine for treatment patients. So community medicine, why the subject is so large? Community medicine has got the applications or knowledge of all other subjects, mainly obstetrics, gynecology, pediatrics, maternal and child health care, everything, the clinical part, and other aspects of community medicine, including plus some other disciplines. You will understand all those things: epidemiology, biostatistics, healthcare delivery system, some administrative, because people will enter in administrative service. So you have to know the administrative management and all those things. So management also so in community medicine, so many things are taught. But all of you, we are not experts in particular field, so you have to know a bit of all. Okay, so that does not mean community medicine is a separate part. Suppose, as I have already told you, in districts, the top CMOH or deputy CMOH and all those things may be from the community medicines. So they may be other things, other maybe medical officers or other doctors, gynecologists, obstetricians, pediatricians, all will work under the guidance of that community medicine expert. That does not mean they are inferior to us. No, for community medicine, because they are planning and all this. All these things we will understand by programs and all those things. Okay, so coming and community medicine, I have already told you, clinical medicine, they taught you when you become ill or diseased, you will go to the doctor or OPDs or other hospitals and all those things. So they are dealing with the diseases, but community disease deals with the health. I am telling you, up to the end of your life, you have to know the definition of health. WHO have given a very simple definition of health. So don't forget it. Never. Even you may be in other disciplines experts, but it is very simple. When you learn it, you have to learn. So many definitions of health is there, but for common people throughout the world, for the medical students throughout the world, the WHO given a small definitions. Every word of it is important, and don't forget it. You need not, once you understand, you memorize it. It is this is a very not a large definitions. So even throughout in exams, suppose you cannot answer much, then examiner may ask you, define WHO definition of health. If you don't define it, you may fail. You may give 0 and all this. So this definition, don't forget, I am telling you, never. And this definition given by WHO. Health is a state, it is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. Suppose, can you tell me I am healthy? You cannot tell me I am healthy. Maybe physically I am healthy, I don't have sign of symptoms. At this point of time, you may not have any sign of symptoms. That means, so you not only physically healthy, you must be mentally healthy. We discuss all this. Mentally very fresh. You have to socially healthy. We will understand it. What is socially healthy? Social well-being, social factors. You are in a family. So in family surroundings, family environment should be very, very good, conducive. You are in a society, social factors and all those will contribute to good. So as per community medicine throughout the world, it is not our definition. This definition given by WHO. And don't forget it, I am telling you. So without knowing it, health is a state of, complete. State, it is a state means what should I say, a condition or like that. Complete physical, mental and social well-being are not merely an absence of disease or infirmity. Everybody, the aim of community medicine throughout the world is to make everybody healthy. Okay, we are trying in that way. That is very difficult. And so many, advancements have been done, as you know. But we have to work much more and all these things. Suppose today I am telling you, when we were students, average lifespan used to call average 60 or like that. What is the average lifespan of India? I am telling you. This comes in the newspapers. These are taught in the schools. Always go to the newspaper. So many things you can learn from newspaper. Average lifespan of Indian population, average lifespan is around 72 years. So it has been increased a lot. And average means someone may live up to 90, 100, and someone may die maybe before 70 or 72, 65, etc. So average becomes all this. And out of this average lifespan of males are more or females are more? Huh? আমি শুনতে পাচ্ছি না. Males, female. You are right. Who told female? Why females? But sufferings, female suffers more. If you go to the OPDs, if you go to the wards, admission wards, plenty of females are there. And you see morbidities, and women suffer from, most of the women suffer from anemia, different morbidities. But so who is stronger in this world, male or female? Females are stronger. Why? Why females are stronger? So many social oppressions are there. As you know, still changes are there, but still this is male dominated throughout the world, mainly male dominated society. Nowadays we are talking about women empowerment and all those things. But so women, suppose even in most of the families, if a son is there, a daughter is there, still in the mind, though these are changing a lot, we are giving much more emphasis on son. Okay, but we don't understand all this. There is no difference, as it is called, between male and female. Gender difference should not be there. Females are stronger because female having the, have you heard of sex chromosome? Female sex chromosome is XX and male sex chromosome is XY. So 2X means same thing, much more stronger. And one is X and Y is different. So they may not be that much stronger. Okay. So these will, okay, other things, these are mainly genetics. All these things. So females are all these things. So these are the improvements of community medicine principles. That doesn't mean community medicine is doing it. All sciences are developing and they are working together. All other subjects of medical science, they work together and with the principles, planning, management and give a healthcare. So it is called a comprehensive healthcare. Often you will see there are terms in community medicine called comprehensive healthcare. Comprehensive healthcare means you have to attain, your idea should be attained physically, complete, physical, mental, social. Another dimension is nowadays coming called spiritual health. That I am coming to. You may call it spiritual, social and spiritual well-being, or may not call spiritual. If you say it, no problem in there. But there is operational definitions. It is a very large operation, means how to apply it. So health is a state of body and mind in which there is no evidence of diseases and the person is functioning normally. We are functioning normally. There is no evidence of disease or substance. That is within normal limits of variations to the standards of health. Someone, suppose I may have some deformity in my limb. I am working. So that means within normal limits according to the variations of standards of health. Right? Generally accepted for one's age. A child, how he at work, a adolescent, who are adolescents? Adolescent kake bole? Huh? Kishor Kishori, Bangla, kader bole? Always remember, teen kotata kotha, how teen came, the word teen? 13 to? Very good. Teen came the word, teenage means 12, not teen is there. 13 to 19 teenagers. But adolescents, from our point of view, throughout the world, as per WHO, adolescents for medical science is 10 to 19 years. Always remember, adolescents are 10 to 19 years. So below 10, 0 to 9 years is children. Okay, and 10 to 19 is adolescents. This adolescent health also developed a lot. That we will discuss all those things in details. Okay, so generally accepted one's age, sex, community, and geographic regions. Okay, and the various organs of the body are functioning adequately in themselves and in relation to one another in equilibrium. So you may not remember operational definition. To understand it, how the attain health, that is given every word. But you have to remember the definition of WHO health. Okay, so many definitions of health, but my request is always try to remember the first one sentence. Okay. So you have seen the physical, mental, and all those things. So in health, to attain health, there are different subdomains or dimensions. One is physical subdomain, I have already discussed. Physical means body related, physical. Your organ, your all these things, physical related. There is various parameters related to anatomical. Anatomy is the structure of the body. Physiological. Physiology means physiology means functions of the body. Functions. You are eating, how it is digested, physiology. You are thinking, cognitive function. Okay, you are thinking. Your brain functions. You are seeing or listening, how your ENT and your eye, ophthalmology, they is functioning. That is physiology. When physiology abnormality goes on, it turns into pathology. Cell pathology, that cell becomes diseased. When pathologic symptoms started, your sign and symptoms, all these things. So for this reason, we have to understand, first is anatomy, you have to know the all organs. In all organs or in cells or histology, all these things you have to understand. Then you have to how these function. How I am functioning with these limbs. How I am functioning with my speech. Okay. How I am functioning as per you communications and all those things. So physiology. And when suppose something develops in my larynx, some different types of all those things. So I may not talk that much. I cannot communicate. There is pathological changes going on. If pathology started, then sign and symptoms started, and people, we call it people suffer from disease. So you see, community medicine starts from the birth of the individual. Physically, you have to improve your health. You have to, how physically you have to improve your health? Always think of very, just after birth. After birth, what are the health promotional measures we give? We ask mother, give breastfeeding, keep the baby warm, or while breastfeeding some techniques are there, or barping, that is after the baby, we take it and all these things, so they barp it. Barp means dhekut tola. So they cannot take and all those things. Keep the baby clean, daily bath and all those things. Keep the baby under sunlight. Why? Vitamin D, very good. Nowadays, mainly ladies and all those things, there is so, vitamin D deficiency is going on in most of the, urban areas is very, very much. Most of you may be suffering from vitamin D because main source of vitamin D is from sunlight, and the food source vitamin D is there, but not much, mainly seafoods and all those things. Some maybe all those things. So for this reason, nowadays people are giving vitamin D capsules or oils, all these things and all those things. But vitamin D estimation is required. Don't take and all those things. Vitamin D is what type of vitamin? There are two types of vitamins mainly, fat soluble and one is water soluble. Very good. So vitamin D is fat soluble. So if you take much, it will retain in the fat, it causes toxicity. If you take B, C, these are water soluble, it will come out from your body through urine and stool, etc. But A, D, E, K, these are fat soluble vitamins. So if you take more, they are fat soluble, they are in the body. So for this reason, it is ideally vitamin D should be taken ideally by estimating your blood vitamin D and all these things. But sometimes doctors give, considering musculoskeletal pain and all those things, every month or every 15 days or every week some capsules back and all those things and asking all these things. So that is health promotion measures. So physically we have to improve them. So for these reasons, all of you understand nutrition interventions. Nutrition means breastfeeding. Then ideal time of complementary feeding or at 6 months it is called. All of these we will discuss. Continue breastfeeding and giving nutritive foods, all those things, etc., etc. physically. Then during childhood, what type of, as we call exercises, all those things, these are health promotion measures. We advise them to take nutritive foods, balanced diet during our, suppose during youth, adult also we allow us to take balanced diet. That is for physical improvement. And physical means then your physiology also will improve and all those things. As nowadays, we used to take, don't take fast food and etc. because all those things, maybe 1 or 2 times. But if you take homemade foods and all those things, all these parameters are good. So these are the principles of mainly community medicine, right? Then mental subdomain, all this will have, person is at peace. You should be peace at himself or herself and with the society, and is able to tackle day-to-day stress without undergoing a breakdown. Today exams are there. I remember my fellow students in the hostel during before exams always used to go to the bathroom, all those things and all those things, or always going to the toilet and all those things. This is the stress and strain. What is the, so that is, he is not 100% mentally strong, mentally healthy. So if you are mentally healthy, you go to your subjects, you are going through your subjects, going through your studies very well. Some things you may say, some things you may not say. That human. So you are at peace with himself or herself. The part we must be at peace with ourselves and with the other, your fellow members, at peace, or your family members and all those things, with the society, and able to day-to-day work with less stress and all those things. Stress may be there, but that should not be much more to cause any health problems. Okay, it is called a bit of stress is always good for achievement, but not much. It is very difficult to measure it. Today, your exam is there. You have to think of it. Yes, I have to go and all those things. I have to at first go to the questions. Then I will start writing which one I can answer better and all those things. That does not mean if you don't think all this, oh, jo hoga dekha jayega, bindas, not like that. Okay, so a bit of stress, but not much. That you are coping with it. That with stress and state you are not suffocating, you are not, sweat and all those things. You are going to the toilets and bathrooms, etc. several times. That should not be the stress. So you are mentally a bit healthy. Social subdomain. Always remember, in our department, there is a faculty, Mr. Ram Mondal is there. He will talk some social factors because all these things we'll understand. Previously, we used to say disease is the cost of the only germs and all those things. Not disease is not caused by only things. the whole social factors are required. Everybody's education, your income, your environment, everything, your political environment, your social environment, everything is required, all causing the disease. So, person is at peace with other members of the community and contributes to the development of the society. So, if you do something for your family, for your fellow neighbors, and for the society where you are living, that is, means you are socially healthy. As we used to say, keep your society, if your pada, if your roads clean, because if you make them clean, it may not, disease breeding, mosquito breeding will not be there, water stagnation should not be there, mosquito breeding should not be there. That is, you are doing so. All these factors are there. So, in disease, not only if, as it is called, air is polluted, soil is polluted, water is polluted, and noise, all these things are polluted. So, disease always remember. Plenty of diseases now environment related. We are in the urban areas, most of in Calcutta and all those things. Always, I stay, my flat is on the bypass near Ruby. So, all throughout the night it is so much of noisy. So, by maybe noisy induced hearing loss slowly developing, people are developing. Okay, honking and all those things much more here. If you go to foreign or western countries, they don't honking of the car not much. You will say traffic line e দাঁড়িয়ে আছে, traffic signal e তাও মানে ইয়ে দিয়ে যাচ্ছে. This is the, because we are not that much on all those things. Okay, everything causes ill health, noise and all those things, everything. Another is spiritual subdomain. Nowadays some used to hold. So, in the definition of health, you can say like that: health is a state of complete physical, social, mental, social and spiritual well-being, and not merely the absence of disease or infirmity. Okay, so spiritual you can add. Nowadays it is slowly adding. Some are called that person. This spirit does not relate with any religion or like that. It means person has love for nature. Often we call nature is the God and all those things. Frankly, in medical science also so many things we still nowadays could not discover. It is nature. We don't know how it is going on. Plenty, still it is developing. Cellular and all those things. Why in all those things? Because we call it is the act of nature and all those things. So, person has love for nature and feels responsible for caring other human beings, animals and the environment. Spiritual practice is also very important in maintenance of health and prevention of disease. I am telling you, spirit does not mean you are the religions related to Hinduism, Christianism or Muslim, Islam and all like that. Spiritual well-being means I must love for our nature, for environment, for all human beings in the society, for animals, etc., etc., keeping them healthy. If I can keep them healthy, environment healthy, I also remain healthy. That is the interaction. So it is called, it is the relationship of the health is the relationship of the total environment. I will come to it, is called ecology, total environment. So health does not always mean your health is affected only because previously in ancient times, it is used to say the disease is the curse of God. This is the curse of God and all those things. After that, when we become civilized, people become educated, then came the theory of germ theory. Germ theory, that disease is caused by due to the different germs, which are bacteria, virus, parasites, etc., etc. After that, in especially this 20th century or like that, early part of the 20th century, this is called disease is not only the curse of germ theory or knowledge. Disease is the interaction of all environment. It is called, we will discuss it in one of the classes. It is called interaction of agent, host, HOST, and environment. It is a modern theory of disease is caused. So, host means our factors, Everybody has different genetic factors, your other factors, your body factors, your all those things. And agent means, agent may be a germ also. Agent may be germs may be communicable diseases called, but agent may be, suppose cholesterol may be agent, is it not? Or other factors of obesity may be an agent, all those things. Malnutrition may be an agent, all those factors. Nutritive factors may be an agent. Okay. Multiple agents, maybe single agent, maybe multiple agents. Usually in communicable disease, which disease transmits, suppose malaria caused by different plasmodium and all those things. That may be single agents or like that. But in non-communicable diseases, heart diseases, cancer, or cardiovascular disease, neurological disease, agent may be much more. It combines with the host factors, how I am fighting with them, my body, since my childhood and all these things. অনেকে আমরা বলি না তোর বডি রেজিস্ট্যান্সটা ভালো আমারটা ভালো নয়, all those things, how we are fighting. And environment, in the environment, how all these things. Yeah, I have already told you, if you keep your environment healthy, if your environment clean, most of the disease agents may not be there. So in non-communicable diseases, so many environmental factors are responsible for non-communicable diseases. Air pollution, very problematic for us. Since COVID, you are using mask. It is better if you use mask every day, always during traveling, especially in urban areas, because you are inhaling so many all these things. And by the side of you, somebody is smoking, so you don't get the passive smoke or like that. And these industrial exhausts, vehicle exhausts, plenty of carbon monoxide, carbon dioxide, benzene, plenty. These after this Diwali and all those things, it is said, probably you have seen, Delhi becomes the most polluted city in the world after Diwali. For few days, Calcutta also in the numbering or like that. Now slowly it is changing. So these are the soil may be polluted, water may be polluted and all those things. Those you are getting the disease. So it is the disease interaction of agent, host and environment. Okay. Now, as I have already told you, my postgraduate degree in MD in preventive and social medicine. So I write MD in bracket PSM. But when you pass, if anybody goes MD in community medicine, you will write MD in com medicine, because at that time that happened. So community medicine, since starting modern medicine, I am talking about, not previously ancient medicine, Roman medicine and all those things. Since ancient, usually at first it is curative medicine, as you know, mainly disease curative, just terms and all those things. Then it came preventive medicine. Actually, preventive medicine started, you have heard the name of who invented smallpox vaccination? Edward Jenner, Jenner. So since Jenner's time, usually 1795 or like that, I cannot remember exactly. So during 18th century, 1795 or like that, he discovered smallpox and giving and all those things, vaccine. And these can be prevented. So the concept of preventive medicine came. And in modern medicine, concept of preventive medicine becomes much more by not only by dietary factors, different diets, by lifestyle factors. Lifestyle, you know, not only diet and all those things, exercise, not doing smoking and etc., less addiction and all those things, and other day-to-day activities, etc., lifestyle factors. You can prevent so many diseases nowadays. You can prevent. Even cancer is also nowadays prevented. 60 to 70% cancer can be prevented if we follow the principles. Okay. Then the name call, as I already told you, social factors are there, different social. So the name call social medicine. After that, the name when we are students call preventive and social medicine. Okay, that is social factors are there, and preventive medicine call department used to call preventive and social medicine. Some of the books I have already told, Park's book, still it is named textbook of preventive and social medicine. Same. Then came the name of public health, it is called, but public all those things, and family and community medicine, so many names, all these things. Ultimately, for the last 20 or 25 years, the name is It is slowly called community medicines. So all these things, because scientists throughout the world, they are working on it. How community medicine. So when you apply principles of medical principles to treat the community, to prevent the community from suffering disease, it is the community medicine. So community, what is community? Community may be a group of individuals living in villages, blocks, town, district, municipal, corporation area. Anybody may be community. Community medicine may be defined as a branch of medical science which addresses health promotion, promoting health, I have already given you, disease prevention, health restoration, that is, treatment is also part in the community medicine. We will discuss all those things. Everything in the community medicine. For this reason, the discipline is large. So you are giving health promotion, that is breastfeeding, nutrition, all those things, taking safe drinking water, taking ideal foods, balanced diet, promotive measures, taking exercises. Then disease prevention, how to prevent different disease specific immunizations or other diseases, all preventing, not doing smoking, etc. So many examples are there. Then if someone suffering from disease, you have to diagnose it as early as possible, early diagnosis. And health restoration, so he suffers from all these things. And rehabilitation, some health complications were there, some deformities developed. So you have to rehabilitate them accordingly. It is called that give the jobs as per his physical capacity. Someone suffering from type of, I will give him that type of jobs. If someone cannot write and all those things, but stand up, I will give him a Darwan's job or like that. So accordingly, everybody can work according to also. Someone may be using this wheels and all those things. Give him according to that type of job, maybe clerical job, because mental health, all these things. So these are the community medicine. Community medicine is different from public health in that public health is the overall mother science, total science, which lays down the various principles and consists of different tools and techniques of broad discipline. That is, in public health, different types of techniques and tools we take and we apply it in community medicine to apply that. So, community medicine is applied for the overall delivery of public health care to a defined community, using the various tools and techniques of broad disciplines of public health, that is epidemiology, environmental science, entomology, entomology means related to the insects, etc., microbiology, biostatistics, etc., etc. So I told you in the initially that community medicine you have to know all the branches knowledge, plus a bit of more epidemiology. It is in the, when you do postgraduate course, epidemiology will become much more. But here a subject is there, a chapter is there, epidemiology. Questions will come in epidemiology. You have to know a bit of statistics. I have to know what is the birth rate here, what is the death rate here. Hey, question class ache? Kader class? Next. Huh? Anatomy. Entomology, microbiology, etc. So this is about clinical medicine, right? I will not discuss that much ecology. Modern content is the ecosystem. Ecology is defined total setting of human beings in the complete environment, and not only the physical environment but also chemical, biological, socio-cultural and socio-economic environment. In the total environment, nowadays as we are developing, we are growing, so many complexes are going on. Socio-political and those factors are coming much more. So it is a total ecosystem we are living, and community medicine is working in that total type of ecosystem. Ecology is concerned with the interactions of human beings in the physical, chemical, biological, social, all these things. Okay. Now we have to know a bit. I will end up here by what is the difference between clinical medicine and community medicine. In clinical medicine, focus is treating individual. You are coming to us, but our focus is treating the whole community. Community medicine principles are applied for the whole community, for Bolpur community, for Muluk community, for Birbhum community, for West Bengal community. Okay, the principles. Concerns. Clinical medicine concerns with the sick persons who come for sick for help. And community medicine, healthy people and sick persons of the whole people. So community medicine is not only taking the only sick persons, but the healthy people, apparently healthy. Even at present we are healthy, so that we do not suffer. So preventing them, promoting them, achievement, right? Goal, clinical medicine goal is to relieve signs, symptoms and cure the patients. But community medicine goal is to prevent, eliminate and eradicate disease in the community. Can you name one disease which is eradicated from this most of the countries of the world, even our country? Huh? Smallpox, very good. And another? Cholera is not, cholera Kolkata hoya karne. Polio, very good. Polio is disease free, slowly and slowly, but still immunization is going on. Okay, polio. So many other diseases, guinea worm disease and all those will eradicate. So it is the applied community medicine. When during our parents' time, you have not given smallpox vaccine, but our smallpox vaccine is there. Very painful and all those things. So prevent, eliminate and eradicate. We will discuss what do you mean by control, elimination, what is eradication, all those definitions are there. Skills and competence. Community medicine, clinical principles, but community medicine, clinical, epidemiological, biostatic, managerial skill. So it is called a community medicine expert is the public health manager. You are the managerial actions. You may not deal with the individual, but তোমার overall idea থাকবে. তোমার under আমি community medicine experts in the district and all those things. I will work on all those things, everything. So I should be a good clinician also, and I should be a managerial experts. Other skills. I should be epidemiological or statistical experts. Workstation, clinical medicine, hospitals and clinics, and community medicine, health centers, hospitals and in the community. So we go to the schools, we go to the different melas and all those things and apply the project. We are aware in the community, etc. Diagnostic and evaluation tools, mainly clinical parameters. What is the hemoglobin level, what is the sugar level, what is all those things. But in community medicine, uses epidemiological tools, surveys. We do survey, research projects. So this is also community medicine, surveillance, studies and health records. Okay. So this is the difference between clinical medicine and community medicine. So community medicine develops a lot, but actually, especially I am telling you, don't take it otherwise. If we apply community medicine, the development of the society, people's total disease development of the health of the population of this country will be much more. But community medicine still in our country, from government, it improved a lot. From political point of view, it is a bit of neglect, all these things. Neglect is there. So you may know the name of different clinical experts. You may not know the name of community medicine experts. That is, socio-political will is not there. But the subject has developed a lot. If we apply the principles of community medicine, we can make a havoc for improvement of the health of the total population. But still, it is different reasons are there. I am not talking in discuss on all those things. That much of all these things. It is much more importance given by WHO and all those things, but that is not applying here. It is said that the top of the DG, Director General of Health Service, Government of India, the top of districts, the top of the DME, the DHS, Director of Health Service, should be, in most of the forums it is discussed, should be from community medicine experts, so that development will be there. But another thing, as you know, I am not discussing because so many things are there who are political system and all those things, who are saying all those things.